Well, improving maternal health is a nationwide issue. In New Jersey, First Lady Tammy Murphy has been leading the charge there. In just 3 years, the state has made significant progress. It's gone from ranking 47th in maternal deaths now to 29th. But racial disparities still remain. Joining us now is First Lady Tammy Murphy. And First Lady, thank you for taking a few moments for us. We appreciate it.
Thank you so much for having me, Chris. I'm really thrilled to be here.
You've been working on this issue since 2019. Your goal is to make New Jersey, quote, the safest and most equitable place in the nation to deliver and raise a baby. So what was it about this issue that you're so passionate about it?
Well, my husband came into office in 2018. We actually understood that New Jersey was in a really terrible place for maternal mortality rates. I, as the mother of four, felt that this was something I should try and lean into, and Phil encouraged me to do so. I was appalled when I found out that, but for the color of my skin, I too could have been one of these statistics. So it has become something that's very personal to me, hearing lived stories from mothers and all the stakeholders involved. So I'm just really honored to be part of this.
So let's talk about some of the successes that you've had to reverse some of the things that you were so appalled by that you saw.
Sure. So as you just mentioned, we were 47th in the country here in New Jersey, and we have now thankfully moved up to 29th, which still is not great. I'd still like to be number one, but at least we've moved up somewhat. We also saw that the March of Dimes gave us an improved report card in November of last year. They looked at 53 states and territories for preterm births, and 47 states and territories declined. One remained the same, and only 4 improved, and New Jersey is one of those 4. We have done this through everything from releasing a strategic plan with over 70 recommendations that we've already tackled over half of those. We have held family festivals, connecting over 6,800 families with state, local, and county resources. We've held summits to bring stakeholders together and tackle really difficult challenges. And I'm really thrilled because just yesterday, my husband signed his 44th piece of legislation strictly regarding maternal and infant health. And we have created the first of its kind authority that will enable us to create an infant and maternal health innovation and research center in the state capitol in Trenton.
And what do you hope that center is going to do? We're looking at some images of him signing that bill yesterday. What are your hopes for this?
My hopes are, by creating an authority, we are able to really bring together all the different departments and agencies within the administration. There are currently 22 departments and agencies within the administration working on this challenge across New Jersey. There are thousands of stakeholders across the state, and there are others around the country who have leaned in and helped us along the way. So this authority will enable us to really mobilize all of that energy under one roof. It will enable us to conduct research. It'll be a place where we can keep the data available for others to see. And it's a place where we can store policy, we can take care of our mothers and babies, and more. I mean, it's really, the sky's the limit.
The racial disparity aspect of maternal health, which you alluded to a few moments ago, it's pretty drastic when you look at the numbers. In New Jersey, a black mother is 7 times more likely to die from maternity-related complications. A Hispanic mom is 3.5 times more likely. So what specifics can you offer people of color who are watching and listening to this right now that they can feel safe having a baby in New Jersey, the changes that are being implemented and made?
There are some very basic changes that have happened. They run the gamut from when a mother presents in an emergency room, or when a woman presents in an emergency room now, they are asked the simple question, have you delivered a baby in the last 365 days? That in and of itself is a game changer. It costs no money. And you should know that of these maternal mortalities, over 50% of them occur postpartum. Most people think that it's something that happens when people are delivering these babies. It's not. It's over 50% of the time it's after delivery. So, everything from expanding Medicaid coverage for 365 days to enable women to have access to health coverage and their babies. There are many things that we're working on, and I would just say we have you front and center. We are listening to you. and we are doing everything we can to make sure that we are building the table together with you and not inviting you to join us.
Well, definitely reassuring, and we look forward to seeing the great state of New Jersey move up from that 29th ranking up to #1, and we'll look to celebrate that when it happens.
Me too, Chris. Thanks.
New Jersey First Lady Tammy Murphy, thank you so much for your work, and thanks for being with us here this morning. We appreciate it.
Thank you so much.